In this video, you will get to know about patient interview. It means that how you can interview your patient when he comes to you. So let's get started. The patient interview physical examination begins. First of all, you have to set your goals. And this will start from collection of data, that is examination data, diagnosis, interventions, prognosis, and plan of action. And it can be called as PICO, PICO. Patient data collection by observation, although general in nature, can affect the remainder of the history taking and physical examination. Now, general observation of integumentary system. This means that how you can observe patient's integumentary system. The element of integumentary system includes skin, hair, and nails, then continue during the remainder of physical examination. Findings that are noted by the physiotherapist are changes associated with the agent, exposure to the environment, local skin disease, trauma, manifestations of organ disease, and systemic illness. This means that the things that are appear on the skin, you have to examine first of all those things that are the changes on the skin, changes on the hair and nails. Skin color conditions. Skin color conditions varies from individual to individual, and it is determined by the presence of melanocytes, carotene, oxygenated hemoglobin, or local blood flow. Melanin is known as a pigment that are found in deep basal layer of the epidermis. It contains brown granules called melanin. It provides protection from sun exposure, as it causes brown pigmentation of the skin also. Local blood flow. Normal skin is attributed by the presence of oxygenated blood through the arteries and the capillaries. As you all know that the arteries and the capillaries are filled with oxygenated blood flow, and you can determine the color of the skin and the color changes of the skin through this. White color means that absence of pigment and the abnormality of blood flow. Blue color indicates there is a cyanosis or decreased oxygenation. Yellow color indicates there is a jaundice, and gray will identify the disturbances of adrenocortical hormones. And nails. Changes in the nails may also indicate the presence of occult disease. Occult means any hidden deformity that is not obvious. The physiotherapist may also observe clubbing of the digits, abnormality associated with chronic hypoxia and lung cancer. You can easily identify the presence of clubbing of the digits in the patients who are having pneumoconiosis or pneumonia disease like lung cancer and chronic hypoxia. Clubbing. It contains three abnormal appearances. Distal phalanx appears rounded and bulbous. Nail palette is convex shape. Proximal nail fold and plate angle increases to 180 degrees or more. This is how you can see the clubbing of the nails. Hair. The changes that appear on hair are alopecia, hair loss of the scalp, most often associated with male and female pattern baldness. It can be a result of a variety of diseases or a side effect of medication use. That hair loss can occur due to any disease or a side effect of any of the medications. Hair loss that occurs quickly or that does not begin in the frontoparietal scalp should cause concern. Brittle hair leading to hair breakage can also indicate illness such as hypothyroidism. Broken hair may be noted later in the examination after patient sits up or after lying on a sheet or pillow. This is the image of a normal human skin. It includes first of all epidermis, then below epidermis there is a dermis and the hair follicles and this sweat glands. Beneath there lies a subcutaneous layer of tissues. Diseases and medication associated with hair loss disease. Infections, hypothyroidism, iron deficiency, pregnancy, and maybe radiation therapy cause hair loss. And the medications that cause hair loss are allopurinol, amphetamines, anticonvulsants, antidepressants, beta blockers, and oral contraceptives or chemotherapy. Skin lesion. The term skin lesion implies the loss or change of local tissue continuity, structure, or function. Skin lesions are benign, associated with disorders such as skin cancer. Wherever you see the word skin lesion, you have to utilize your knowledge, or you have to set a background that it means there is some type of or some sort of cancer, that is the local tissue continuity, structure, or functional maybe. Early detection of disease is important as it may lead to a good prognosis for a doctor or a patient. Who initially detects the lesion seems to be linked with the severity of the disease at the time of diagnosis. Criteria for ABCD rule. Acronym related to warning signs of melanoma. B for border irregularity, C for color variation, D for diameter greater than 6 mm. If the patient problems do not lie in the physiotherapist zone, refer the patient. And don't try to uh, resolve the problem by yourself. If it does not lie in your domain, then please do a favor to the patient and refer him. Observation. During the interview, the face, neck, anterior shoulder girdle, hands, and feet are typically visible. Physiotherapy should also be vigilant for abnormal body contours that may be manifestations of masses or abnormal fluid accumulation, that is edema. The questions that you can ask from your patient are: you aware of this lump? Is this lump painful? Has the lump changed within the past few months? The neck masses that you can identify by palpation. This can be include thyroid, parotid, submandibular gland, and local lymph nodes. Glandular surface tend to be lobulated and irregular compared with the smaller lymph nodes. Abnormal lymph nodes may be tender. They can be painful when they get touched. Pain generated from an inflamed lymph node often presents as dull, diffused, non-localized. During the patient examination, question may arise as to whether the palpable mass is a band within the muscle belly or involves the lymph nodes. That whether the mass that you are going to palpate is a band within a muscle belly or it involves lymph nodes. To clarify the involved structure, physiotherapist can elicit a light contraction of the local muscle while palpating the lump. If lump does not change from a palpation perspective, mass is probably superficial to the muscle belly. Shoulder masses. If the patient is not wearing a shirt, tank top, or sports bra on, the therapist may be able to observe the clavicular and the anterior glenohumeral joint regions. You can easily identify these regions if the patient is not wearing a shirt or easily exposed. The upper and outer breast quadrant is often the site of neoplasms. As described earlier, physiotherapist who palpates as a lump in the region should attempt to determine if the mass is within the local musculature, packed major muscles, or within tissue superficial to the muscle, breast tissue. If the mass is superficial, it cannot change, probably not the change in lump, while elicit a gentle contraction of the local musculature. This is the quadrant of the breast, four quadrants: upper, inner, lower inner, upper outer, and lower outer. If the physiotherapist has any concern about the nature of the noted mass, follow-up questions should be asked. Have you noticed this lump? Has the physician examined this area? Has the lump changed? Is the lump tender? Have you noticed any change overlying the breast? Have you noticed any nipple discharge or retraction? Observation that you can see in nervous system. General nervous system examination involves gross movement patterns, gait. You have to analyze the balance and you have to look at the tremors that he or she is having at that time. Asymmetrical facial features. You have to look out for pupils, ptosis, and strabismus. Then you have to go for the facial inspection, including the pupils, eyelids, gaze, and movement of the eye during the interview. It can reveal important findings. Mydriasis. Abnormal pupil may be enlarged. When pupils are abnormally enlarged, this can be called as mydriasis. Meiosis. Pupil constricted. Meiosis may be associated with parasympathetic medications or conditions such as Horner syndrome, as it also involves ptosis and exophthalmosis. Ciliary flush. An intense circle of redness around the iris called ciliary flush and is associated with inflammation of the iris or cornea and acute glaucoma. Observation of ciliary flush would warrant an immediate consultation with the patient's physician. Ptosis. Drooping of the eyelids. Unilateral ptosis is a classic component of Horner syndrome. To maintain the visual field, patient may compensate by contracting frontalis to raise the upper eyelids, or it may be called as frowning. Bilateral. Is there any pain in or around your eyes? Is your physician aware of the condition? Additional follow-up questions that you can ask. Have you noticed any recent changes in your ability to smell, taste, swallow, talk, or hear? Have you noticed any recent changes in your balance, memory, ability to concentrate, or paying attention? Patient is asked to follow the finger with his or her eyes, and the eyes should track together. Then physiotherapist asks the patient to follow the finger as it moves towards the tip of the patient's nose. Again, the eyes should converge together. These are also known as coordination tests. If the eyes do not track together or in the presence of strabismus, the degree of misalignment varies depending on which direction the eyes are moving. If the eyes do not track together or in the presence of strabismus, the degree of misalignment varies depending on which direction the eyes are moving, especially when accompanied by diplopia. The patient's physician should be contacted. This is how you can test for visual field. Hearing. During the interview, hearing deficit may be suspected by the physiotherapist or reported by a concerned patient. There are three types of hearing loss: conductive hearing loss, sensorineural, and combination of both. Conductive means that it involves the middle ear, outer ear, or both, and sensorineural means it only involves the inner ear. If the patient reports the suspected hearing loss is of new onset or has recently worsened, tests should be included in the physical examination. Whisper test. The first auditory acuity test, because of the outer, middle, and inner ear are all assessed simultaneously. The physiotherapist whispers the familiar and asks the patient to repeat the words that were whispered. Weber test. After striking the tuning fork in the palm of the hand, physiotherapist places the fork firmly on the vertex of the cranium or mid-forehead. Patient is then asked, "Do you hear the sound? If so, equally in both ears." A normal response should be "Yes, I hear it equally in both ears." If the sound lateralizes to one ear, and the subjective complaint and the whisper test results should be reported to the patient's physician. This is an image of the